Hello everyone and welcome back to a new video. In today's video I'm going to be explaining a few different things that I have been getting a lot of questions about. But before I get started with this video, I just want to say thank you guys for being patient with me. I know my posting schedule is not really a schedule. It's been like a long time since I've posted. And I know everyone has been waiting for this video and for multiple videos to be coming out. And I'm working on them, I promise. It's just been a lot around here. It's been very busy. Preparing for a new baby is very time consuming, so just bear with me. I promise it'll get better. But my dogs are filming with me today, so if you see dogs behind me, that's my dog. That's Willow, and then there's a puppy that's beside her that you might see. So if you see them moving around this video, sorry. I'm sitting on my floor because this was like the best angle with the best lighting. So yeah, sorry about that. But in today's video, I'm going to be talking about shots. I get most of my questions about shots and why I take them, what they do, how I take them, you know, how much I take them, how often I take them, and stuff like that. So I'm mainly going to be talking about these, but I'm going to be giving you a big pregnancy update and all that good stuff, because I think the last update was like 25 or something like that weeks, maybe 30 weeks. I'm not exactly sure, but let's get started with this video. So, shots. I take these shots twice a day. They are called Enoxaparin, which is Lovenox for short. Everyone knows them by Lovenox injections. Some people call them Heparin, low dose weight heparin, stuff like that, but I call them Lovenox. I take 60 milligram twice a day, so 120 milligram a day, and it's 60 milligram per 6 milliliters, so 0.12 milliliters is how many I take. And I mean, I'm not going to take this because it is like 10 o'clock at night and I've already took my shot. I take it at 8 a.m. and 8 p.m. So I'm not going to take that for you. Plus, I know a lot of people are very squeamish whenever it comes to needles. So I'm not going to torture you with that. But I will open it for you so I can like show you how it works, I guess. But like it shows the medicine, how much it is, expiration date, stuff like that. And they're very like child-proof. Like it may take me a minute to get this open, but they make it to where your kid can't really get into these. So it comes like this, and it's like in a little tray. You open it, comes out like this, and then it says the medication name yet again. I don't know if that's focusing. But it comes with a little bit of air bubbles in the line, so sometimes you just flick it like this and get all the air to come to the top. It says not to disperse the air, like, because it can make some medicine go out, but I always do it because it bruises me if I don't. So you can take it off, and there's the needle. It is a little bit thick, not very that long, but it goes just underneath your skin. You just find a spot on your stomach to pinch, and just stick it at like a 40-degree angle or 45-degree angle, so like this, and then just press the syringe in, and then there's a safety device whenever you're done, and it will come over the top to where nobody can get the needle. Nobody can touch the needle. So it's very safe. It'd be very hard for a child to get into or anything like that. I keep my shots in my closet on the very top shelf, to where no one can get to them. No animals, no children, anything like that. So there's that. Now let's get into why I take these shots. So I have what is called Antiphospholipid Syndrome. I have made videos about this before. but it is where the normal proteins in my blood are attacked, and it can cause blood clots, miscarriages, um, just a list of different things that it can cause. I have had the blood clots in my lungs. I had that in June of 2019. And so, like, it's kind of crazy how they diagnose you. They can diagnose you with blood tests, or they can diagnose you by, like, this algorithm. I just recently seen a hematologist, and she drew my blood, and then she gave me the algorithm that explains why I have to take these shots during pregnancy and how they treat this syndrome during pregnancy and stuff like that. So a lot of people think whenever they hear like antiphospholipid syndrome or APS that it's like impossible to have a baby, but it's not impossible. They make these medications, for reasons. I know they didn't make this just so pregnant women can have successful pregnancies, but it is the only thing that doesn't pass through the placenta, and it is the only thing that is safe. So Lovenox, and then there's another one called Heparin, which I will be talking about in a few minutes. But she basically says my syndrome is if you had one or more episodes of unexplained blood clots, like unprovoked, which means there's no really cause as to why you have them, then that is one thing that qualifies you for antiphospholipid syndrome. And then also you need 2 to 3 or more cases of a miscarriage before the 10th week of pregnancy, and I have had 2 of those, so that qualified me for that. And so there's like a prophylactic dose, and then there's a therapeutic dose, and one maternal fetal medicine doctor wanted to put me on one dose, and then my hematologist put me on the correct dosage. So that was very important that I seen the hematologist. She switched me to 60 milligram twice a day, and then I also take a aspirin, like a baby aspirin is what they call it, and it's only 88 milligram. So I take 120 milligram of blood thinner and then 88 milligram of aspirin, which is, they use it as another blood thinner. So I'm on quite a bit, but I mean, it's to be expected. They don't want any blood clots possible to pass through to the baby because it can kill her. It can kill me. If I was to get a blood clot to pass through to me, it could kill me. So it is very dangerous, and it is very important that I have some form of blood thinner in my system. So let's talk about heparin. Heparin is the other blood thinner that is safe for pregnancy. It has a shorter half-life than the Lovenox injections. Lovenox injections stay in your system longer than the heparin does. And so I was supposed to switch to heparin right at 37 weeks, which was on Friday, and today is Sunday. But the pharmacy that I use did not have the correct heparin in, so I had to wait until Monday, which is tomorrow. So I'll be switching to heparin injections tomorrow. They want me on those because if I was to go into labor on my own, there would be more of a chance it would be out of my system by the time it was, time to push the baby out, time for labor. And so I'm going to be starting that on Monday, tomorrow, and I'll do 2 injections twice a day like I'm doing right now at 8 a.m. and 8 p.m. And it'll just be better for me. And yeah. Now, I know I'm kind of all over the place with this video, so I hope you're able to keep up with me. But still talking about the injections here, let's talk about after I give birth. So after I give birth, I will still be on these injections for 12 weeks. I will not be on heparin after I give birth, only up until I do give birth. And then if I have a natural birth, it will be 6 hours after that I will go back on to the injections. And if I have a C-section, then it will be 12 hours after the C-section that I go back on the injections. And I will resume those for 12 weeks along with the baby aspirin. And then after the 12 weeks is up, I'm going to go back on warfarin, or some people call it Coumadin, which is a pill that I take once a day, not twice a day like this one. And you have to monitor your INR and just like what you eat, because certain things have higher vitamin K levels and can reverse like the blood thinner. It can make it not work. So if I was to eat too many leafy greens, or I think cranberries is one of them, then it can completely stop the blood thinner from working. So you have to monitor yourself, like with the medications that you take. But that is pretty much the plans for my pregnancy. I take them for blood thinner. They make sure my blood stays nice and thin, and they are saving me and my baby's life. So I'm very thankful for them. They are painful. They bruise you and they cause knots and stuff like that. But it is well worth it. I don't have very much longer. I have 13 weeks left. With the injections, I have 1 week until my induction date, which is the 11th of January. And if you want me to vlog that, I will try my best. Just let me know in the comments. I'm not going to like show any gruesome, nasty stuff if I vlog it. Just like the process and how it goes and stuff like that. So I want to do that, but I don't want to do it if no one wants to watch it. So make sure you guys let me know about that one. Okay. Last but not least, let's talk about my pregnancy and how it's going. So I'm 37 weeks pregnant in 2 days. I'm considered full term. Now it is like preterm, but it is full term. If my baby was born right now, she most likely would be okay. Her lungs may need a little bit of help, but that is expected with all babies that are born like preterm or like a little bit early. If she was born right now, she would be almost 3 weeks early. So it's possible that she would be okay. She probably wouldn't have any NICU time, but I'm not a doctor. I'm not her. I can't, tell you how she's going to be whenever she's born. I don't know that. But I do know that she is, at 35 weeks and 5 days, she was 5 pounds and 8 ounces. And she was in the 27th percentile for her growth and weight. So that is okay. She could be bigger. But, there's got to be some baby that is 27 and below, or else, all humans would be the same, and all humans aren't the same. All babies aren't the same. So it all works out eventually and in the end. So I am 37 weeks. I do not experience like any sickness or anything like that. I just am really tired and out of breath, and it's hard to get up, and I have a big belly and stuff like that. But it's not hard. It's not difficult. It's just smooth sailing from here on out. I know I don't have much longer, so I just have to hold on and, stick with it. Let's see. I have gained 35 pounds, I believe, throughout my whole pregnancy. I was 109 pounds before, and now I'm in the 140s-ish. I haven't weighed myself in a while, but I see the doctor once a week. Well, I see the ultrasound tech once a week, and sometimes I see the doctor once a week, or at least twice a week. It depends whenever she is in. I haven't seen her in 2 weeks, but I will be seeing her tomorrow to hopefully discuss, further my induction date and stuff like that. Make sure she doesn't want to induce me any earlier. But for now, I will be 38 weeks and 3 days on the planned date whenever she induces me. So we'll see if that changes. Last time I seen her, I was 1 centimeter dilated and 80% thin. So that is a very good sign. And that means hopefully labor should go smoothly and I shouldn't have any problems dilating and stuff like that. So that is pretty much it. I have everything that I need for my baby, and we are ready for her. We've been cleaning the house and nesting and anything possible, everything possible, to get ready for this baby. My sleep schedule is off the charts, but I know that it's not going to get any better when the baby gets here, so I might as well get used to it. But I think that I shouldn't have any problems, adjusting to it and stuff like that. I'm really excited. I've been waiting so long for this baby. We've been trying to have a baby since we could remember. Like, we've always wanted to have a baby, and we first got together December of 2016, so it's been like 5 years, and it's finally our time to have our baby and stuff like that. So we're very excited. I'm going to be vlogging hopefully a lot more whenever she gets here. That way it can be more interesting content, and you don't just have to sit here and hear me talk. So make sure you look forward to that. If you're not subscribed already, make sure you're subscribed to the channel. I'm not going to promise when the next video is going to be up. It could be next week, it could be tomorrow, it could be in a few days. I'm not exactly sure. All I know is I could be induced tomorrow, so I don't know if I will be able to get another video out in a couple of days or anything like that. So if I'm not induced tomorrow, it'll be in a week from tomorrow. So I'm very ready. I'm getting very excited and anxious and just ready to meet her and hold her. So thank you guys so much for watching this video. I hope I was able to give you a better explanation as to why I take the injections and blood thinners. If you have any other questions, feel free to leave it in the comments, or you can direct message me on my Instagram. I'll leave it in the description below. Just ask away. Ask any questions that you want. Thank you guys so much for watching, and I'll see you in the next video. Bye.